It's another beautiful Tuesday, and we are so happy to have you join us on the program, Health Talk 360. I am Khadija Abubakar Isa. Welcome. This program is proudly brought to you by the Nigerian Television Authority, just to keep you informed, because your health is our priority. Last week, we did talk extensively about prostate cancer, and today we are going to forge ahead, because we have come to discover that prostate cancer is a very important topic that needs to be discussed. What happens after prostate cancer? According to my doctor, most times men hear that you have been diagnosed with prostate cancer. Suddenly, you will see the mood changes, confusion sets in, fear. But one thing that many people don't know is that that is not the end of life. It is the beginning of a new journey of discovery. We are going to be looking beyond diagnosis, the supports that every man needs, what you can do to help that person very close to you, and then a lot more. We are going to learn about stories, the science behind it, and of course the strength behind that man that has been diagnosed with prostate cancer. Thank you so very much for joining us. This program is live, giving you the opportunity to call and ask questions. You can send us through short medium service or just on Facebook. This program is streamed live. You can get us there at NTA Lokuja on Facebook, and then we continue this conversation. So if you do actually care about that father, that uncle, that brother, that son, please let's stay connected as we begin this program with a Vox Population, with an interview on the street where we went to sample people's opinion. A lot of men don't talk in our communities, and that is one of our major issues. Why are our men actually not talking, especially when they are not feeling fine? Let's join them.
A lot of men don't like talking about their health due to societal limits like family, friendships, relationships, stigmatization, and even economy. Today, we are out here on a state to stop people's opinion on why men love keeping safe to themselves. Join us.
Prostate cancer, possibly most people don't like talking about it because it's a private issue that has to do with their private life. Because one, their fear of possible victimization, fear of people like inferiority complex, and believing that people will be looked down on them with that sickness. But the earlier they say it out, the better. The earlier they say it out, they address it, the better for them, so that they can get themselves back and be the man that they used to be before prostate cancer came.
Unlike the women, they always open up when they have any slight difference in their body. They quickly go for medical checkup. But in the area of men, they don't like talking about it. They tend to hide. I don't know what's really making them feel that way, but they always shy away from the truth. And the fact that one is diagnosed with prostate cancer doesn't mean the end of the life of that man. It's something that can be taken care of medically. So the earlier you open up, the better.
So my own perspective, men in their nature are always private with their issues. Even concerning the family affairs, health, and societal information about them, they always keep it private. And be it a health issue, it will be something challenging for them to speak out to anybody for any assistance. They keep it to themselves. So there's some extent to go to an extent that to get out of her to be controlled early. When they speak out early, it will be detected early and they will have a quick response for it. But I believe with our initiative and interaction, we have to speak to them to come out with a health issue they have, in terms of educating them on the importance of speaking out their health issue, discussing with partners, especially the wife or the colleagues in the office, to bring out the best treatment for them at early stage to avoid a advanced stage of health issues.
Like, I know most of them, they don't really come out to talk about it. Because why? They believe that everything is okay. Why am I saying this? Whenever you talk about health issue against them, because we all know that now the food we consume in our body system, it kills our immune system. It spreads some things that damage our body system. But by the time you go to them and talk to them about health issue, they say they are okay. Maybe they are afraid of the money or what they will spend or how the thing will weak them down. By the time you explain to them the truth, what they should do about their health. And
the society we are living is not too favorable to men, and men are always advised to hide even their commonest emotion. So when you complain or when you speak about something, they view you as a weaker person. And because of that, even when you have a life-threatening disease, it becomes a problem because of the phase that the society is taking. You want to see yourself as strong when you are waking and you are dying with a life-threatening disease. So these are part of the reason. But men will have to start getting out of that situation that is not helping. Most of the life-threatening disease, like the sudden death, like heart attack, is more peculiar to men. It's the men that you see a man just attending a meeting, he will fall slump and just die. Because the pressure, the stress, the societal stress is much, and there's no activity, and you keep bottling it up until you can't bottle it anymore, then it explodes.
Well, I don't know for a lot of other persons, but basically for me, or personally for me, I don't talk about my health issue with people like that, because I don't like being a burden to anybody. Like there are some times that I have some issues with my health. I don't actually relate with my parents most of the time. It's quite dangerous, but I don't know. You just stay like that. This is very dangerous because most of the time you can just your entire system or your entire immune system is just shut down for a while, and you start running helter-skelter because why? You do not actually tell people what you are feeling or how your health is. I think while I was in school the last time, I had an experience. I was studying, I was actually feeling down, but I didn't relate to anybody. But in the middle of the night, everything escalated and it was just God.
Economic factor is one of the major challenge why we see that men don't speak out about their health, because sometimes they find it very difficult to pay their bills. And as such, go for medical checkup. Even they fear. By the time they tell you you have this and have that, with the family problem, people find it difficult to express themselves. And sometimes with the remuneration that they get from their various offices, it's not enough. So many things psychological issues are also compounding the issue by the day. Sometimes at family level, they needed to attend to something, they don't have enough money, and the health, they feel that okay, they could manage the health like the spare tire. But unfortunately, it will just happen that way. And sometimes it's maybe ignorance, you understand? And they feel medical checkup is to go and create fear and discover what you are not expected to know.
So people don't like exposing their personal issues outside. And then it's very, very dangerous for their heads. Because the earlier they know, the earlier they get treatment, so that it won't cause unnecessary havoc to their heads. So to me, earlier that if they could be able to detect that earlier, then they'll be able to get earlier diagnosis about it. So that's just the summary of everything I can see, which is not that okay for their heads to be quiet about it. So they have to speak out. Because when you speak out and talk about it, that's when others can know and you can get a solution. But when you don't talk about it, there can't be solution.
This is what you gathered about why men don't love speaking about their health. Back to you, Khadija, in this
Thank you so much, Rufai, and that's it. Different opinion, but the one that captivates my heart so well is the one that says men in this society are not valued or so. And then the last lady who said that men need to speak up and then always go to the hospital, because when if it is detected early, there will be a solution. What is your comment on that, doctor?
Yes, this battle against with prostate cancer we're trying to change the narrative. Our patients are diagnosed at advanced stages, and this is because people don't come in early. We've spoken about the serum PSA, which is a blood test.
The blood test.
That people, it's a very simple test. You just do it, and it gives us the value. Men should get screened. That's the way we can change the narrative. And we don't need to wait till when we have symptoms before we start seeking for help. When you are well, a man, 50, 45, 50, you should get that PSA test done. It's nothing big, it's not that expensive. It's just a blood test.
Remember, we are in November.
Yes, November.
November. The movement have just started. So let's take the first step to getting screened. Okay, let's quickly go back to the conversation. We've been discussing prostate cancer, and this week we are looking beyond diagnosis, what happens. And with me is our dearest doctor, in person of Dr. Ayodeji Ogumola. He is a consultant urologist from Federal Teaching Hospital here in Lokoja. Doctor, once again, you are welcome.
Thank you.
So
thanks for having me.
I earlier mentioned, this program is live, giving you the opportunity to call and interact with your doctor. So our lines are free from now. You can begin to call and ask the question, because last week we went extensively talking about prostate cancer. Now it's live after being diagnosed. What happened? What are the kind of support? Those are areas we intend to explore on Health Talk 360 today. And the numbers you can use in sending us your question or comment contribution is simply 09070245924. Okay, let's take it again. 09070245959. We are expecting you. So let's run a quick look at the areas we covered, from the definition, the signs, the symptoms, and preventive measures. Quickly.
Okay, so we said that the prostate gland is a gland that is found only in men. It is located just underneath the bladder, and the urinary pipe passes through it to bring urine out. The function of the prostate gland is to produce the fluid semen, which is called semen, that stores the sperm cells and allows for transportation of the sperm cells out during ejaculation. It also produces some part of the work it does is that it nourishes the sperm cells. That's what the prostate is. Now, the prostate cancer, in any cancer, what it means is that a particular group of cells are behaving as if they are not part of that organ. They are dividing so fast, they are not dying when they should die, and then they could detach from their organ and go to another place that is not that organ. So if that happens within the prostate, we say that somebody has developed prostate cancer. So that part of the prostate is growing abnormally, and it can detach, go to the bones, go to the brain, go to the lungs, and cause problems for patients. That's why we're saying, before we get to this stage, it's a slowly growing cancer. It's a slowly growing cancer. And in majority of situations, it is said that prostate cancer patients die with their prostate cancer than die of their prostate cancer. But there's this subset that is very aggressive. That is the set we are trying to catch. That is the set that we want to catch early before the problem deteriorates. Yes.
Okay, now we're talking about early detection. What, for men who have been diagnosed, what are the kind of first steps they need to take, especially after hearing the news?
Yes, so I can imagine the situation when I have to tell somebody that, okay, the result of your biopsy is out, and the result is not looking too good. You can imagine he's going through a lot of emotion, a lot of emotions. Maybe he has all these things planned out, and a sudden diagnosis of cancer in this environment means that, oh, maybe I'm about to die. So he goes through a lot of emotions, the fear, the hopelessness, and all that. Well, you can't deny the emotions. You should experience the emotions, but you should not sit in the emotions. You need to rise above the emotions, and that's what we will encourage. You need to seek information. What exactly have they told me? Get information. Get information. People get more of misinformation than the real information. So get information about the disease. Get information about how things can go, about treatment. Then, by the time you come back to see your doctor will be able to explain to you more. Then maybe another thing that people should do is maybe they could seek a second opinion about the treatment plan. You could seek, okay, my doctor has told me that, oh, this is the stage of my cancer. This is what I am supposed to do. Well, you might want to get another opinion of another doctor. Sometimes some people may even request for what we call the tissue block that the pathologist prepared. Maybe they want another pathologist to look at it. Yes, so those are the things that we can do. And of course, seek support from your family members. Sometimes you may need to come with your wife or maybe with your son and then hear what the doctor has to say. But at that time, the patient needs serious support because we don't want them to go into depression. We don't want them to suffer anxiety, and we don't want them to suffer any form of psychological disturbance because of the disease.
I can imagine that kind of situation. One can only imagine it when you are not there.
Yes.
But actually, life is life. And anything happens once we are living, we just have to try and see what we can do at that very moment. And I know as doctors, you often give psychosocial support to make sure that at least the person will be able to receive the news positively. So in that line, how can patients kind of try to maintain a positive mindset, especially during treatment?
Yes, so I've mentioned some of the little things that we can do. What I would advise again is that the patient should not just focus on, I have a diagnosis of prostate cancer. You also need to focus on what you can do. Focus on what you can do. You understand? The diagnosis of prostate cancer, yes, is life-changing, but it doesn't mean that the end has come. And the end may not even come. People can go on to become other things, start new businesses after the diagnosis of prostate cancer, depending on if you get the right treatment. I think I need to add here, one of the problems we have is that people hear this and you don't see them again. They fall into the wrong hands. So seeking support is one thing. Support from your spouse, support from your family, and what we've been able to do from our program today is that we've been able to kickstart a support group. Kickstart a support group where people can come and share experiences. You know, people at various levels of experience. There are people who have had prostate cancer for a long time. There are people who have been just recently diagnosed. So they can share experiences. And then in a support group system, everybody is more relaxed. You can talk among yourselves. You can talk about how you were able to handle this. The doctor, if he's there, is a little bit more relaxed. They can explain things to you. So a support group system also helps. But we must not play about with getting the right information about the disease.
About this. Okay. Now, so what are the common side effects of prostate cancer treatment and how can they be managed?
Okay, so
because I believe one of the reasons men usually come and then disappear is probably, okay, don't even start that medication because if you do, there's going to be an adverse effect.
Okay, so maybe the first thing I should say is that the treatment you offer the patient depends on the stage of the disease.
Of the disease, okay.
So it could be localized prostate cancer.
Okay.
If it's localized prostate cancer, patient could have radical prostatectomy. Radical prostatectomy could now be open when you have to cut open the patient, or it could be done laparoscopically or through robotic means, what we now call keyhole surgery. And we now have facilities for that in Nigeria. The common complications of radical prostatectomy, one, people may suffer erectile dysfunction. So people may suffer erectile dysfunction. People may also suffer urinary incontinence. But these are things that can be addressed. These are things that can be addressed. The worst situation is that you could, if many of these problems will resolve over time. They will resolve over time. But if they don't resolve, for erectile dysfunction, you can have at the highest form of the ladder insertion of implants for the patients. But that's not where to start from. It's a step ladder thing. You go little by little and all that. For incontinence, you can use pads, catheters, but again, you can have artificial sphincters inserted for the patient that helps them control urination. So that's for radical prostatectomy. For radiotherapy, problems with radiotherapy are related, sometimes close to problems that patients who are also on chemotherapy receive. But maybe I should just quickly go to the common treatment we offer patients in this environment. Majority of people come in locally advanced and metastatic phases. And at this stage of the disease, you cannot achieve cure. But you can treat the disease and control the problems. So prostate itself depends on a chemical called testosterone, which is produced by the testes. So there are ways you can get rid of this testosterone, either by removing its production, by removing the testes, or by giving injections, which can be monthly or 3 monthly. We usually do the 3 monthly because by the time you look at costs, it might be easier to do the 3 months. So what are the complications of removal of the testes? Of course, somebody who has had his testes removed cannot talk of having more children. And then there will be what you call loss of libido. It doesn't even have the sexual drive again. The common problem they have is hot flushes. So you just have this sudden feeling of heat with sweating that disappears. It's close to what women experience too about when they have menopause. Understand? Hot flushes. Sometimes they can begin to increase in size. You have truncal obesity. The bones could become weak. And these effects could either is the same for either removal of the testes or for the injection. But as I said, it is not sacrosanct that the patient must have erectile dysfunction because you remove the testes. There are things that can be done to help the patient. There are drugs you can give that can help the patient to still have erection so that you do not pause the life of the patient.
So now, are you invariably saying, let's say, prostate cancer now can cause infertility and sexual performance for men if diagnosed?
Yes, it can cause some form of erectile problems, but it does not mean it cannot be addressed. Erectile problems have ways you can address it, and it's usually in a step ladder fashion. You keep trying this. If this has failed, you move until you get to insertion of implant at the last stage.
So now with this background, what do we expect our men to do? Because one of the things I am a little worried because we find ourselves in a community where men find it very difficult to talk. Thank God we are starting the November movement. At least with that, our men will begin to open up. So what else, apart from opening up, what else should our men do? I know the last time we talked about going for the test, but let's keep an emphasis on that.
Well, I think maybe another thing that we can, men just try to be men. And it will be important to see the thoughts driving this. And we'll be surprised that some of these thoughts may not be thoughts that are universal all around the world. It may just be cultural symptoms. It may just be cultural.
So it's something we can actually let go.
So it's something we can let go. Because these are just attitude and beliefs that we can overcome.
That's true.
Understand? We can overcome them. We can step out and talk. We can step out and let other men come out when we come out. So that other people who are in silence or who are completely aware can take a second look at their bodies and know whether they need to be checked up on by their doctors.
All right, thank you so much, Doctor. And thank you too for being there on the program Health Talk 360. As I told you, this program is streamed live on Facebook at NTA Lokoja. And we are glad some of us have started sending some questions, and then we'll be expecting more and possibly call, because this program is very, very important to all of us, because it's a discussion that has to do with the heads of our families, our fathers, our brothers, our uncles, our husbands. And as such, we all need to come out and talk about it and encourage our men to talk about their health. Before we started this program, you know, the streets interviews we had, a young man we interviewed was saying there was a time he had issues, you know, related to his health, and he's been so used to that culture of silence. So he was finding it very difficult until the issue escalated. Though he said he has learned his lessons, and I hope you too watching the program, you would have learned from his lesson. So we're going to take a short break, and when we return, the program continues. Don't forget, this is the time for you to call, this is the time to send your questions, and this is the time for us to continue the conversation online. See you there.
For over a decade, we kept you informed, helping you make smarter health decisions with preventive education. We took a short break, not just to rest, but to recharge and bring you something bigger, bolder, and better, tailored to what your health deserves, with a new name and amplified mission. Get ready for a healthier you as we introduce to you Health Talk 360. Join us every week as we explore the latest health trends, debunk myths, and expert advice from childcare, nutritional, to mental health. We will cover it all because your health is our priority.
Tune into Health Talk 360 on NTA Lokoja and take control of your well-being every Tuesday at 5:30 to 6:30 p.m.
For over a decade, we kept you informed, helping you make smarter health decisions with preventive education. We took a short break, not just to rest, but to recharge and bring to you something bigger, bolder, and better, tailored to what your health deserves. With a new name and amplified mission, get ready for a healthier you as we introduce to you Health Talk 360. Join us every week as we explore the latest health trends, debunk myths, and get expert advice from childcare, nutrition, to mental health. We will cover it all because your health is our priority. Tune in to Health Talk 360 on NTA Lokoja and take control of your well-being every Tuesday at 5:30 to 6:30 p.m. Yes, your health is our priority, but for last week and this week, the health of our men is our priority. All right, thank you so much for joining us again on the program Health Talk 360. And I have been with our doctor, Dr. Ayodeji Ogumola, a consultant urologist from the Federal Teaching Hospital here in Lokoja. Well done, doctor.
Thank you so much.
It has been 30 minutes of extensive learning. For me, I am learning because I have a lot of brothers, I have a lot of friends who are men, and I will be glad to share the little I am learning. I hope you are also doing the same. So last week, we started the
Movember
movement. Can you quickly tell us what happened, and then what are the questions? Because I knew after the program last week, we still receive a lot of questions, which are one of the ones I have here, but I don't know. Do we also entertain questions during the program? Because
Yes.
I know a lot of our men have questions to ask, but because the culture has asked them to keep quiet and they have been keeping silent.
Yes, so as part of the Movember thing, we organized this Prostate Cancer Summit. And we were overwhelmed with questions. There were so many questions. Some were bold to step out, take the mic and ask their questions, but we passed papers around and we had so many questions. So many. We tried to answer as much as we could.
Can you
but
share some
because
of these
time.
questions with us?
People were worried about what are the problems of prostate cancer treatment. Will I still be able to have erection? Some people want to know the difference between benign prostate enlargement and prostate cancer. Some people wanted to know if you're on a catheter, can you get rid of it? Some people wanted to know, are there ways that people can be supported with funds? Some people wanted to know about support groups. But people have questions. And for me, these questions that men are asking that we could not completely answer shows that if men were given the opportunity to talk, they would talk. It is just this culture of silence that we're talking about, which we're trying to overcome. So if men get the appropriate environment where they know that everybody there, there's nobody that is going to be ashamed. Nobody is going to laugh at their question. They would ask their questions. They would ask their questions.
Well, I believe that time is now. We don't actually need to keep quiet. I have seen women deliver and their videos are being used for learning purposes. So when it concerns our health, I don't think we should be quiet. We shouldn't answer silent with silence. No. It should be back to back as is silent. Prostate cancer is silent. And as such, we should open up and speak because early detection is key. So can prostate cancer return after successful treatment?
Yeah.
How can survivors kind of stay vigilant in that situation?
So if a patient is diagnosed early, he can be cured and be completely free of the disease.
Okay.
In fact, part of what we spoke about, one of the speakers was talking about discussing with a colleague in the UK who is a neurosurgeon, and people come in their 90s for neurosurgical evaluation, and part of what they tell you is that, 20 years ago, I was diagnosed with prostate cancer, I've had treatment. So you see people who prostate cancer is just a comma in their life. It's not the full stop. There's just a comma, and they continue to live their life. And that's what we're trying to see happening
this side of the world.
in this side of the world. You understand? That's what we're trying to do to happen in this side of the world.
Okay, let's quickly go to some of the questions we have here. Abubakar from Ghana Jazz Junction says, Doctor, can a man still live a normal life after being diagnosed with prostate cancer? Thank you so much, Abubakar.
Yeah, so a man can live a normal life. And then maybe just using this to answer the last question that you said. So after the localized prostate cancer, the person can have cure. Now, in the locally advanced and metastatic, after the treatment, the patient is fine for some time. Sometimes they say 18 months, 24 months. But the cancer have a way of overcoming that obstruction. Understand? And now develop what you now call castrate-resistant prostate cancer. What does castrate-resistant prostate cancer mean? It means that some group of cancer cells has found a way of overcoming that castration. Understand? 95% of the testosterone comes from our testes, but we still have some 5% that comes from other parts. So those ones can drive the growth of new cancer cells. But the good thing is that there is a treatment for every stage. There's a treatment for every stage. And some of the guidelines now, they do not just offer what we call androgen deprivation therapy, which is either removal of the testes or the 3-monthly injection. Sometimes some people give some form of chemotherapy. Some people give addition of some drugs like abiraterone in addition to that, and they found out that things improve in this patient. But the good thing to say is that there is something for everybody. There's a form of treatment for everybody. At some point, you get to what you just call life-sustaining treatment. Understand? There's something. I don't want to go into technical terms,
yes.
but there's something for everybody.
For everybody.
There's something for everybody that you can continue to push life with. I mean, at some point, maybe things may fail, but there's something for everybody. What we want to make sure is that prostate cancer is not a full stop to your life. You don't stop your life and then focus on the prostate cancer. You deal with the prostate cancer and move and continue to live your life, start a new business, do what you want to do. Yes.
Another question is coming from Grace Lokongoma, phase 2. She says, my husband is currently on treatment. Please, can prostate cancer affect a man's sexual performance or fertility?
Yes, fertility, if it was diagnosed late and has had removal of the testes, of course, it might be difficult to have further children. Understand? Maybe abroad, what they can do is sperm banking. It's possible to bank the sperm cells, so patients can always have children through artificial reproduction. So infertility might be something, but for those who get injections, if they do well, they've not removed the testes. You can stop the injection and have what you call drug holidays. If they do well, the PSA is coming down, patient is doing very well, then sometimes you can give them time and see how things go. So, but problems with erections can be solved. If you seek help, the doctor might be able to find something for you. Understand?
All right. Okay, and that's it for you, Grace from Lokongoma. Emmanuel from Adonkolo says, what foods are good or bad for someone recovering from prostate cancer?
Okay, so I do not want to give a general statement about, eat rice or eat this.
Eat rice.
Understand? I think the general guideline I give, that I tell patients, is if you stick with the general information that doctors give patients about their health, you're fine.
You're fine.
So you don't want to smoke, you don't want to do alcohol. Some people will say, okay, maybe some light alcohol, well, you can't stop that, but you don't want to do heavy drinking.
Yes.
You understand? And if you can avoid alcohol, I would rather recommend that you should stay away from it. You want to do plenty of fruits, vegetable. I've even found patients who, after a diagnosis, practically changed their life. Some people now go on sour soup, go on, and well, do we have evidence that it helped? I can't say. I've not checked. It might be possible, but they live good life. They live good life, and maybe what we should be looking at, we should be adopting these attitudes before patients actually develop the cancer. And maybe not prostate cancer itself, all cancers, either breast cancer, cervical cancer. We should generally improve our diet. Then, of course, you want to stay away from, you want to cut down on red meats. You want to cut down on red meats.
Even considering the age.
Considering the age, not just because of cancer, but generally for your health. You want to do more of fish, things. You want to cut down saturated fats. You just generally want to eat healthy. You want to cut down on sugars. You want to cut down on snacks. These are general guidelines that everybody needs to live a healthy life. You want to improve exercise. Understand? You want to improve exercise. You want to cut down on your weight. General things that we do. You want to rest.
Stay healthy.
By the time we adopt these things, life generally improves for us.
It's very true. When you need to rest. Sometimes the rest could be just 30 minutes now, and then you discover that you're just all well again.
Yeah, you feel refreshed.
You feel refreshed, and that's very true. So thank you so much, Emmanuel, for that question. We have another one coming from Aisha from Fileli. She says, how can families, especially wives, support their husbands going through prostate cancer treatment? Thank you so much, Aisha. I've been waiting for this question.
Yes, family support is very, very important. Extremely important. Because that is almost like the first line of defense for the man. The man wants to continue to do life. I'm the man, I'm the father of the house. He does not want to show his vulnerability. But we need that support. We need that support. And I must really admit, many of the patients who come, they've been getting support either from their children or from their wife. Maybe for me, I would think maybe one of the advantages that, I wouldn't say it's an advantage, but You know, prostate cancer occurs at the time in your life when you are trying to settle down. The children are growing up. You know, everybody is independent. They don't want to lose their parents, so they do all that they can do. You understand? So maybe that is a little form of advantage, but the family support is very, very important. But we're going beyond family support. We're trying to see how patients can support themselves. Patient who has been diagnosed with a cancer supporting another patient that has been diagnosed with a cancer. And that's why we have kickstarted this support group in the Federal Teaching Hospital, Lokoja, and it's open to every patient that has been diagnosed. We have patients from specialists attending who attended the program. We have patients from private hospital who attended the program, and we are very, very happy for anybody within Kogi State. In fact, if you want to come from anywhere, it is open. It is open for anybody that wants to. And it's not something we just want to do now. We hope that this will continue. It will outlive every one of us. And as other generation comes, they will see how they can develop this thing and make it stronger.
That's great. It's a success stories. At least we are taking a step. Change don't just happen. Someone have to start it. And thank God we are partners. One of the things we cannot just do is to keep the public informed, and that is what we are doing today. And we are happy with the step that you are taking. Musa from Patamake says, does having prostate cancer mean a man can't walk or do physical activities again?
No. No. Patients can have prostate cancer and continue to do your exercise. We don't need to pause our life because of prostate cancer. Of course, if somebody comes late, maybe he now comes with complication, what we call cord compression. The cancer has gone to the back, and it's now making it difficult to walk. But of course, with treatment, with physiotherapy, with radiotherapy, the patient can walk again. So patient can walk, patient can do exercise, patient can go on with their life. Part of the things that we hope the support group will do is some form of exercises that we can do. Either indoor exercise, outdoor psychological exercises. We hope that people will be able to get that done with the support within the support group.
Okay, we have another one coming from Baba Usman from Kabawa. He says, hello, doctor. Some people in my area say herbal medicine can cure prostate cancer. Is that true?
Well, I don't want to dispute this person. In medicine now we talk about evidence. You don't dispel anything without having confirmed it. Understand? But what is sure, we shouldn't leave what we know for what we do not know. Understand? These treatments that people are offering now have gone through different forms of assessment to establish that they are the right treatment. You know, the way removal of the testes was discovered was very funny, and the man went on to get a Nobel, an award for that, because he found out that people, if you take out the testosterone, this can improve, and he got the award much later. So I would rather advise patients. Yeah, you want to do herbs, I would not discourage you from your herbs, but herbs should not be the main treatment. Get the right treatment. The right treatment, the right orthodox treatment. And maybe I should say this now. It's not every form of prostate cancer that we even offer treatment. And that might be very surprising to a lot of people. There is a form of treatment where we call active surveillance. And what we do in active surveillance is a form of expectant management. You are delaying treatment. You are not taking the action now. And sometimes it might even be more intensive than taking treatment, because you need to keep checking, saying that sometimes you have to even repeat biopsies, check MRI to see that there is no evidence that the cancer has progressed. So if you find any evidence that the cancer has progressed, then you can take action. But for people who have low-risk prostate cancer, as I said, we have low-risk prostate cancer, intermediate-risk prostate cancer, high-risk prostate cancer, depending on how we classify. We have things we use in classifying. Those with low-risk prostate cancer may not do anything. And we have another form of expectant management, which we call watchful waiting. Now, active surveillance is done for people with localized prostate cancer, not with people who have advanced or locally advanced prostate cancer. Active surveillance is for localized prostate cancer, so we delay action till when we see evidence of progression. But in the setting of advanced disease, in the setting of progression disease, sometimes you want to do watchful waiting. Watchful waiting means that you take action when you now find evidence that the disease is progressing. You don't want to remove the testes or start that injection immediately, but not in the setting where the patient is very bad. If you come with bad symptoms or your kidneys are already failing, you're already needing blood transfusion, you're already having bone pains, no, you are not going to be doing expect. You want to quickly salvage the situation at that time. Understand?
Wow. This is coming from Veronica from 500 Housing Unit. She says, how important is mental health during prostate cancer treatment, and where can patients get counseling support? Thank you so much, Veronica.
And I would say that for me, that question for me is very apt. Very, very apt. Because during the sessions today, while I listened to my colleague, Dr. Egbiola, speaking, I seem to have learned new things myself that I might not be aware of. Yeah, while we talk about the fact that, the patient is both the body, he has a mind, he has his emotions, and we're trying to focus on that. But, while he spoke, he said that the patient is not just what we see. There's a part of the patient we don't see, which is also suffering the prostate cancer. His mental health, his thoughts, his fears, his emotions. And these are parts that men don't like expressing. So mental health is very, very important. And that's one of the things that we intend to look at in this our support group. For about a year, we are going to be giving patients some tools where we would assess their level of anxiety, their level of depression, standardized tools, valid, that have been standardized. We will check their level of anxiety, their level of depression, we check their quality of life, and then we're going to be looking at their how much they get lost to follow up, what we call their attrition rates. And we'll be assessing it at intervals and seeing whether there are going to be improvement through this support group that we are starting. So mental health is very, very key. Very, very key. While we take care of the physical problem that the prostate cancer has caused, the emotional problems, the mental health problems that is associated with the disease, the fear, the anxiety, the sadness, the depression, those are the things that we are seeking to see that we can address also. And the aortic just finished sometimes, I think this week or last week, and part of the things they focused on, I wasn't in attendance, but I saw it in one of somebody's posts on LinkedIn, is they are trying to see that for oncology, which is cancers, they're not just focusing on the patient. They are looking at what we call psycho-oncology, psychosocial aspect of the disease, because the patient is not just the body that he brings to you. The patient is going through emotions. So you want to address those emotions. You want to address those problems that the patient is also experiencing. Yes.
All right, thank you so much, Doctor. We still have a lot, but I know we are going to do that subsequently. And what advice do you have? Because this topic, I don't know why it's quite important to me, because I have seen men struggle through these. And I just feel it is that time for us to talk it out, to encourage people to begin to speak up and seek help at the very, very early stage. What advice do you have, especially for our men who want to
my final thoughts, this is November. Every man, 45, 50 and above, you've never done a serum prostate-specific antigen done and test done, get it done. It's just a blood test. It's not, you are not getting exposed to any form of radiation, just a blood test. Get checked. If you have a diagnosis of prostate cancer, seek help. See your doctor. take the treatment that has been offered for you. And then patients have a lot of questions in their mind. One of the things we did in this support group is that the urology unit prepared what you call a patient information leaflet. And that's the booklet I've been holding since. We have this patient information leaflet that was produced by the urology unit of Federal Teaching Hospital. We have some, almost like 14 questions. We had more than...
And the responses.
And the responses. So these are questions, these are things that, questions that people are seeking answers for, that we feel that they can get. And of course, there are more questions you have in your heart. Go to a hospital, see a doctor, get help. Let's see how your questions, and let's see how we can overcome misinformation. Because I think that is one of the problems that we have with prostate cancer.
That's very true. Thank you so much, Dr. Ayodeji of Mola.
Thank you very much.
Thank you too for being on the program, Health Talk 360. It has been an hour, an extensive hour of learning, relearning, and unlearning. It's beautiful that we have chosen to be on the program, Health Talk 360, just to learn so that we can make informed decisions about our health. Yes, it's okay. Emotions, nobody can stop it. But when it comes, in fact, not just prostate cancer, anytime we visit the hospital, we should visit it with a very positive mind. Because the only wealth we have that we can call our own is our health. So I don't think there is the need for us to be ashamed, to be afraid, or to be confused when it is time for us to know what is going on with the system. Thank you so much for being part of the program, and I hope that you have learned one or two things. And this session has also encouraged our men out there to begin to seek, answers to the lot of questions that they've been bottling up, thinking they are just being men. I don't think you need to be men when it comes to do with your health. Thank you, thank you, thank you for listening, thank you for watching, and thank you for all the contributions on the program today. I say a very big thank you to the crew member who made this program a success. Please, let's not disconnect. Let's stay connected, because this platform is specially made for you to stay informed about your health. Until we meet again in another interesting edition of the program, Health Talk 360, I remain Khadija Abubakar Isa. Encourage that man, that's your neighbor, to visit the hospital for screening. Thank you. Goodbye.